Well, good afternoon, everyone, and welcome to the first Regional Interact Training webinar session presented by the New England QIN-QIO. My name is Carol Dietz, and I'm here with my two other presenters from Connecticut, Sheila Eckenrod and Florence Johnson, to welcome nursing homes from all 6 states in New England, which are part of the New England QIN-QIO region. These states include Connecticut, Massachusetts, Vermont, New Hampshire, Maine, and Rhode Island. The Interact webinar series will be about 12 months in length, occurring on the last Wednesday of each month from 1 to 2 p.m. every session. Each month there will be new tools from the Interact program that will be discussed with recommendations from our certified Interact instructor, Florence Johnson, as well as how to implement each of these tools within your facility. Then you will hear from our expert quality improvement consultant, Sheila Eckenrod, on the quality improvement process of tools that will be discussed each month that will go hand in hand with the Interact tools that are being discussed. Before we get started, I just want to review a few housekeeping items. The call is being recorded for training purposes. The recorded presentation will be available within a few business days after the webinar, and I'll provide you with details on accessing the recording at the end of the webinar. All the phone lines are on mute for the duration of this presentation, but we will be taking questions at the very end, at the end of the session if there is time, and I will provide you with the instructions how to unmute your phone at that time. So, with no further ado, I just want to go over the objectives of the day. Again, we welcome all the nursing homes from the New England states. We're going to be going over some readmission data from each of the states and also understand the New England QIN-QIO goals and activities. Then we're going to go into the Interact program and do a nice overview. Florence is going to give you a nice overview of the program, as well as then we're going to talk about forming an Interact team and the necessity of this, because you can't have the Interact program without an Interact team. And then at the very last 15 minutes, we're going to have a sharing session, but this is state-specific, and I'm going to be sharing that information with you once we get to the 45-minute mark. So, again, Florence, Sheila, and myself would like to welcome all of you to the Interact program. You are truly starting a journey. You are truly a pioneer for your facility as well as for your state. And we will be with you each month as your journey continues on. I would now like to introduce Sheila, who will discuss the readmission data and the goals of the New England QIN-QIO.
Thank you, Carol. Well, welcome Interact participants and pioneers. We're all happy to be here. We're looking forward to helping you to fully implement the Interact program in your facilities. We want to help you reduce unplanned 30-day readmissions, improve communication within your facility, and improve communication with outside providers. So we welcome you as partners and pioneers in this effort. Now, a little bit about us. We are your New England Quality Innovation Network Quality Improvement Organization, QIN-QIO. That's easy for me to say. So where did we come from? Some of you have worked with us in the past as the state-based quality improvement organization, Qualidigm. Last year, the Centers for Medicare and Medicaid Services, CMS, formed 14 QIN-QIOs from the existing 53 state-based QIOs. That includes Puerto Rico. The goal of this reorganization is to provide economies of scale, prevent duplication of efforts in a geographic region, and to leverage experience and expertise. Our goal in New England is to become the healthiest region in the United States, and the goal for this initiative is to reduce unplanned readmissions by 20% as mandated by CMS in this scope of work. So why unplanned 30-day readmissions? As many of you probably know, up to 1 in 5 nursing home patients will be readmitted to the hospital within 30 days of their initial admission. Unplanned readmissions cost more than $17 billion annually, and numerous studies and clinical reviews, which you might have also read, have demonstrated that up to 79% of unplanned readmissions are preventable. And those studies were conducted by clinicians, nurses, and doctors reviewing cases on a case-by-case basis. But on a more human level, we all know that when we send residents out to the hospital, they return to us changed, and very often not for the better. So whenever we can treat in place, most clinicians that work in long-term care would opt in for that. So where are we now? Where do we begin? We'll take a quick look at our readmission rates from SNS to acute care facilities by state. And this is calendar data, so when I look at this type of data, I like to compare one quarter to the next because we know that there's real seasonal variations in hospitalization rates among the long-term care population. So here's Connecticut. We're looking at quarter 3, 2014, the most recent data we have. Quarter 3, 2013, we were at 19.1%, now at 18.8%. Rhode Island also decreased in quarter 3, 2014 from their rate in quarter 3, 2013. So that's Rhode Island. New Hampshire remain the same across that quarter-to-quarter comparison. Vermont, again, you can look at the trend line. I probably should have mentioned that dark black line is the New England region average. So when we look at Vermont, that we can see that their readmission rates are below this New England region average. Okay, now we're looking at Massachusetts. And finally, we're going to look at Maine, also staying pretty stable across those two quarters, quarter 3, 2013 to quarter 3, 2014. All right, so that's where we're starting, and I know that we're going to end up with a 20% reduction in all states in our region. So how are we going to do that? We're going to do that with Interact implementation across the communities of care. So let me pass the ball over to Florence Johnson, my colleague and our resident Interact expert, who will provide you with an overview of the program and tools.
All right. Well, thank you, Sheila and Carol. Welcome, everyone. As to start off our conversation, I would like to ask everyone a polling question. And my question to you is your facility currently using any Interact tools at all? And your choices are, you're using all the tools, you're using some of the tools, or you're not using any tools. So I will give you a few seconds to weigh in. So how do we add it?
Submit.
We can hear some feedback, and if your phone is not muted, could everyone just please manually mute your phone at this time? Thank you. All right. Okay, that's great. So about 33% of the participants are using some of the tools, so that gives us an idea of where we are. This is awesome. So as Sheila quoted to you before, about 1 in 4 Medicare patients who are admitted to skilled nursing facilities from hospitals is readmitted back to the hospital within 30 days. These readmissions cost in the excess of billions of dollars annually. A few years ago, about 2 years ago, hospitals began to pay penalties for increased readmission rates, and the fines for skilled nursing facilities are on the horizon. I think within the next 2 years, skilled nursing facilities will also be fined for high readmission rates. And as Sheila also noted, many of these readmissions are avoidable. So that's why we're here today, because Interact is a program that can help you not only improve care and the quality of life, but it could also help you decrease your avoidable readmission rates. So you ask yourself, what is Interact? Interact is an acronym for Interventions to Reduce Acute Care Transfers. It's a quality improvement program that focuses on the management of acute changes in resident conditions. It has clinical and educational tools and strategies that you can use in everyday practice. And right now it's mainly focused on long-term care, but some people probably do know that it has extended into assisted living and home care. So Interact is designed to catch changes in conditions early on before it gets into full-blown symptoms. It improves the way you communicate within your facility, within your team members, and it also improves your communication between skilled nursing facilities and your acute care settings. Interact actually started as a special study grant that was given to the Georgia Medical Foundation, which was the QIO for Georgia, back in July of 2006. CMS wanted them to look at why a lot of the nursing homes in Georgia had such high admission rates. But then they also had a small population that was doing very well in keeping their readmission numbers low. So Dr. O, because I can't say his last name and I'm not going to butcher it, with his team, they got together and they went into these facilities and did some studies over time. This grant was actually from 2006 till 2008. At the time when they started the study, 68% of the rehospitalizations were found to be avoidable. They developed a toolkit out of this whole program, and they used these toolkits in the skilled nursing facilities that had the highest readmission rates. And these hospitalizations were actually able to be decreased by 50% using the tools that were developed in the study. The goal of Interact is to improve care. It is not to prevent all hospital transfers. We all know that, in fact, there are transfers that cannot be avoided. But what Interact is saying is, for those that can be avoided, let's try to do that. Let's try to treat people in place. But when you do have to transfer someone to the hospital, Interact can improve the transfer process, and it'll make the transfer itself as seamless as possible. So by avoiding hospitalizations, we are decreasing the emotional trauma that this transfer can result in for the resident and their family. It decreases complications of hospitalization. When you have people who have dementia, to transfer them out of their comfort zone into a hospital actually worsens their condition. Avoiding hospitalizations also reduces the overall health care cost, and it will help you to prepare for the changes in the payment system for Medicare. Interact helps to improve care by decreasing the frequency of the transfer that could potentially harm a resident. And we always want to treat our people in place with the people who know them the best. So there are four major components to Interact. We have the quality improvement tools, the communication tools, decision-making tools, and advanced care planning tools. Now, each of these areas are designed specifically for certain members of the care team. And although most of them are for licensed staff, it's important that everyone in your building understands how these tools interrelate to each other, and everyone in the building should know that you are using the Interact program. One of the key components of being successful in implementing Interact is that we need you to have administrative buy-in. Not only the administrators in your building, but your medical staff. So it doesn't really work that well if only the people in your building understand that you're using Interact. It's important that your medical directors know that you're using this, your advanced practice nurses, and also your acute care settings that you're sending people to should know that you are participating and you're actively using the Interact program. All right, at this point I would like to get into the website itself. If you're just in listen mode and you don't have a computer in front of you, we have provided you with screenshots, and you can follow along with the screenshots. So at this point, I am looking at the home page, and you can reach the home page by going to www.interact2.net. All right? So this is the home page. And to get into the nursing home tools section, you want to go click into Interact Tools. And this license agreement section, you're not buying anything, you're not spending any money, you're just agreeing that the Interact people own the academic rights to this, and that you will use their tools the way it was intended to be used. So you have to agree in order to be able to cruise through the website. Now, let me just make a note that when Interact first started, it was just Interact. And over the years, they've improved upon it. When I was trained on it, we were at Interact 3.0. As the study has gone on, people have given input on suggestions on how to improve on Interact and the different tools. So as different versions come on, they will increase the numbers. So now we are actually at Interact version 4.0. All the tools are still the same, but they have improved upon them. So we want to click on Interact 4.0. So if you're following on paper, you should be on slide number 13. So this is the overview of the whole site. It gives you overview of the Interact Quality Improvement Program. It talks about how to use it in your everyday life. And this is just a quick overview of how you can use the Interact tools and how you can make it work in your everyday life. And again, we will be going through this in more depth as we talk about each tool. I will not spend a lot of time on that. The next section that's important is the Quality Improvement Tool section. And this looks at the 30-day readmission tracking tool, which is right there. You see the Excel symbol, and that really looks into your numbers. It gives you a lot of detail about who you're transferring out and who you're bringing in. The next section is the communications section, and this is where you'll find all your communication for in-house as well as transferring people outside of your facility. We have the Stop and Watch, which was initially designed just for CNAs and has now grown into families using it, your ancillary staff, anybody at all that touches your residents. Then we have the SBART tool, which is a clinical tool for communicating change in residents. This really walks you through how to present the changes to a clinician, and at the very end of it, it talks about what it is exactly you're looking for from the doctor. So you're not just calling them up to say, Mrs. Jones just doesn't look good today. The SBAR stands for Situation, Background, Assessment, and Request. So you're really building up on what is going on here. This is what's happened in the past. This is the assessment that I'm seeing here, and this is what I'm calling you for. And there's a really nice document in this section for medication reconciliation. In this section, there's also documentation on how to engage your hospitals. If you're really new to Interact, I would spend some time here. The nursing home capabilities list is for you to be able to communicate to facilities, your acute care facilities, what you're able to offer clinically within your own building. So if you send a person out, they can send them back because you're able to do A, B, C, and D. Again, as I said, we will go through each one of these tools in depth. All right, and the decision support tool section. And if you are following on paper, you should be on slide number 15. Sorry for that. This actually looks at acute changes. It's in there's some card files that you can have at your nurses' stations. And for a new nurse or a nurse that's coming back into nursing after years of being away, this is a great tool to use. It gives them at a quick glance, this is what's going on with Mrs. Jones, and these are the things that you should be doing. Yes. And it's very portable. We also have the Care Path that just walks you through each of these common diagnoses and how you should treat the person. There's a lot of yes or no questions, and then it guides you to what you should do next. The advanced care planning tools talk about just having the discussion about end of life and what it is a person wants done with their life as they're towards the end of their life. So having the discussion, not just when an issue happens, but as they come into the facility and with every changing condition. All right, so that's really a very brief overview on what's available on the website. And as I said, each month we will pick a tool and we'll dive deeply into it, so don't panic. So let's move on. Okay. So I saw that sorry, we had a we're just getting back to the slide. Sorry. Okay, there. There's a delay. Okay. So, as per the polling question, many of you have already started to use the Interact tool. And if you have, this is a great document, and you can pull this down from the website. It actually has you going and checking which tools you're using and how you're using it. And it'll actually reveal some opportunities for you to be able to implement further more tools. Because a lot of times people use one or two of the items from the program and they say, yeah, we're using Interact. Well, Interact is a full program. It's not just about the tools. I liken it to if you're baking. You just can't pick and choose which recipe items you're going to put in making chocolate chip cookies. If you don't put the eggs in, you're not going to have a well-made, gelled chocolate chip cookie. You'll have crumbly dough. So if you don't put the chocolate chips in there, it's not chocolate chip cookies, it's just dough. So it's very important that if you take on this project and you want to become an Interact facility, it's important that you implement all the tools. And if you take one thing away from today, it's the importance of having leadership buy-in. And by saying that, I'm not saying that a leader has to be the one to champion this cause. It does not have to be a director of nursing. It does not have to be an administrator that leads this. You need to find someone who has a strong desire, who really believes in Interact, and wants to improve communications and help to reduce readmissions in the building. The other thing that we found is that sometimes an administrator wants to interact and they assign it to someone, and when that person leaves the facility, the whole program dies. We also recommend that when you implement Interact, that it becomes part of someone's work process. So if, as an educator, I take it on and I leave next week, it should be part of my job responsibility so that the next person coming on knows that as part of their duties, they have to take on Interact and continue to help spread what you started. So that will be it for me. And I will pass this back on to my colleague.
Thank you, Florence. So I'm going to talk about the very first step on this journey, and that is to develop an Interact team. So, as many of us have learned the hard way, forming a team that can function effectively over time is a difficult task and is no way accomplished quickly. Frequently, it takes more time for the diverse individuals on the team to come together as a team than it does to actually accomplish the work, leaving us at times feeling like this poor fellow on the slide that everyone's just gotten together to work against me. But as Florence pointed out, we can't stress enough that a multidisciplinary and diverse team is absolutely essential to affect this type of deep behavioral organizational change. Interact tools and processes will affect all facility staff, and to successfully implement them, you will need commitment at all levels, from the medical director to housekeeping and volunteers. So it is essential that all of these groups are represented on your team. We understand that it is difficult to pull busy staff away from resident care, so if you have an existing quality improvement team or any team that routinely looks at data, such as a pressure ulcer or infection control team, you may consider adding Interact implementation to that team's task, with the expectation that other team members may need to be added for this particular initiative. You may find the team has members who are not used to working together or have being worked on any team, and this is why the designated facilitator is important. I'll talk about that a little bit more in a minute. The team needs to meet at least monthly, and during a busy time of implementation, you may even consider brief huddle meetings of 15 minutes around a specific task if needed. Establishing team norms is a powerful method for ensuring that team members actively participate in the process. Participating in decisions about how the team will function fosters greater commitment to the initiative and understanding of the task. At each team meeting, the team meeting will, at a minimum, want to review readmission rates and other measurements of Interact implementation and design methods of reporting this information to the rest of the facility. So let's talk about some team basics. It's absolutely imperative that the Interact team be multidisciplinary. This, again, is an initiative that's going to affect everyone from the medical director to housekeeping, facility pet. Everyone needs to be on board with this. It's essential that the people who are going to use these tools are involved in the implementation plan, and they will become your missionaries. They will become the ambassadors of Interact, the people you pull into this team. So let's review some team basics, how to launch a successful team. There's really only two things a team has to do. One is ensure that the tasks that are needed for the project are completed on time and well, and the other, which is a little trickier, is ensuring that the members of the team communicate and work together well. The team needs to begin by understanding the overall goal of Interact implementation, as well as the specific smaller goals of the implementation that's going to be involved in each individual tool and process. Specifically, in launching your team, here's some things that you're going to want to clarify. You're going to start with the end in mind. Talk to your team about what your facility will look like when Interact is fully implemented, when everyone's using all these tools. Start with that vision and work backward from there to do a step-by-step analysis of all the tasks that need to be done to produce that ideal outcome. Ask yourself what tasks can be grouped together, what things can be rolled out simultaneously, what things have to be done sequentially. Have members volunteer, or if needed, assign members tasks based on their skills, their interests, and willingness to do the task. So if you have someone on staff who likes to teach, that's what they're going to do. If you like someone who likes to read charts, that's what they're going to do. Speak to people's strengths, and you'll have a much more committed team. So a little bit more about team basics. Defining roles can be very helpful, and I would certainly recommend it. A team needs, at a minimum, a leader, and the role of the leader is to manage the team, call meetings, handle administrative tasks, organize activities, oversee preparations, pull together the team as needed. If the leader is in a managerial position, that's always a challenge because you have to sort of leave that at the door if you're really going to listen to and have investment from people in different levels in the organizational structure. The team leader is also the person who will communicate with the administrator or the owner of the facility in terms of what's going on and what's needed for this effort to continue. Another good task is to have a facilitator, or another good role. A facilitator, it should be someone with a combination of people, technical, and training skills. Ideally, a facilitator is not a formal team member. However, very few skilled nursing facilities have the luxury of extra people sitting around, so that facilitator will probably need to wear more than one hat. It's sort of a complex role, and if you haven't tried it in a group before, you might need some coaching, might need a little help. feel free to call us. But basically what you want your facilitator to do is to sit in a meeting and look around the table and see who's participating and who isn't. So if your attention is all about the nursing supervisor who's saying, yeah, I can do this, and no one's noticing the LPN sitting to her left who looks horrified at the idea and calling out to them and saying, what's going on here? What are your thoughts, Janine? Do you think this is going to work? You look concerned. That's a powerful way of mining the expertise and the information that people bring. So I would encourage you to do that. A timekeeper, like the one I have on my left here, at Rhode, is the person who's going to make sure that you work through the agenda. Another very, very important thing. Nothing's more frustrating for a team than to consistently drop things off their agenda. And if you have the luxury of somebody who can and is willing to take minutes, that's fabulous. If not, at the very least, you need a task list. These are the things we agreed to do. These are the people who agreed to do them. Okay, reporting out. You cannot do enough of this. You want to talk this up. You want your team to go forward and talk about it at staff meetings. This is what we did this week. This is how that implementation went. Someone needs to present as med exec. A powerful thing is to tap into team members who don't usually go to med exec. You've got a CNA who's got the moxie to do that. That's a powerful thing. Talk about the stories. The CNA that used stop and watch and prevented a rehospitalization. A clear communication between caregivers. A communication that failed. These are the things that people remember. People remember stories. Consider posters and visual aids. This is how far we've gotten. This is what our readmission rates are. This is how many SBARs we had turned in this month. This is how many stop and watches went our way. And make sure everyone hears about Interact implementation. And I'll tell you, if you really want to measure how successful you are in implementing this tool, have somebody stop in on 11 to 7 and ask the CNA who works full-time nights what Interact is. And if he or she can answer that question, you know you nailed it. All right, thank you. I'm going to turn this back to Sarah.
Okay, everyone.
We're going to open the phone lines for just about 3 minutes. We have about 3 minutes left before our 45 minutes is over for this training session. So if you have a question for the team, whether myself, Carol, Sheila, or Florence, you can unmute your phone by hitting *6. You need to say your name, what state you're calling from, and then ask your question. So we're going to give you about 3 minutes. If anyone has a question about the Interact program, the overview of Interact, or about starting a team, if anyone has a question about implementing a team, we'd love to hear it. Just for those of you who are listening, if you're thinking about a question, our next month's webinar, which will be on March 25th, will be on the readmission tracking tool, the Interact readmission tracking tool. And that, again, it will be from 1 to 2 o'clock in the afternoon. Okay, we have a question online, and the question is, do we report any of our results gathered on these forms? If so, where? I'm going to let Florence take that one.
The 30-day readmission tool is really the only tool that collects data for you that you can share. And if you are part of a care transitions community, we encourage you to share that data within your community and also with us here at Paradigm. But you should be having discussions within your community. And not only that, sharing the data within your facility. We tend to hold on to our data, but it's really nice to share with not only the clinical staff, but everyone in the building to show how you're improving.
Also, in a couple of webinars from now, Sheila will be talking about the PDSA cycle. which is the Plan, Do, Study, Act cycle, and how to monitor how your intervention is going by using this cycle. So that's going to be another tool, another quality improvement tool that we will be teaching you on how to use it and when to use it, so you can monitor how your implementation is going on all these tools. Are there any other questions that are coming in online? Would anyone like any questions for Sheila, myself, or Florence? If not, I'm going to move on. Oh, I have another question. The question is any of this information going to be linked to the CNS? Oh, excellent question. Florence is saying, I'm taking this one.
Excellent question. None of this information is linked in any way to CMS. It's not linked to the state survey agency. This is just us providing you with technical support and information to help you be able to do your quality improvement.
An excellent question.
CMS is actually giving you something free. You're getting free consulting from us.
Okay, the slide that I have up. Oh, I'm sorry, is there a question?
Yes, can you repeat the website?
Yes, it's www.interact2.net.
Thank you very much.
You're welcome.
And we also just put that in the chat box, so you'll have it right there in the chat box for you. So the screen that I have up, this is the Regional Interact team for Connecticut. However, if anyone within the New England QIN-QIO region, which is the Connecticut, Massachusetts, Rhode Island, Vermont, New Hampshire, or Maine, if you do have any questions about this webinar, please feel free to call us, and we will triage the call if you're looking for state-specific information. So please, anyone within our region, please use us as your Regional Interact contacts. We'd love to hear from you. So the next 15 minutes, and I'm so happy we're on time, we are doing a sharing session which is very state-specific. So, but before I go into the sharing session, I just want, for those of you who will be dropping off, I just have some further general information for everyone on the call. Each of the participants today will receive a follow-up email with a link to an evaluation about today's webinar. We ask that you please complete it. It will be brief, so really we're not looking for a half hour of your time. It'll take you about 5 minutes. Your feedback, though, is very important to us, and it helps us to provide you with meaningful programs. Also, within the next few business days, we will be sending out another email to all that have registered. So even though some people haven't been able to make the call, but they have registered, they're going to get this email with instructions on how to access the presentation and the recording to this webinar. So again, those are the two emails you'll be receiving from the New England QIN-QIO concerning the webinar session. Okay, so here is the state-specific instructions for the next 15 minutes on the sharing session. And after each of these training sessions for the next 9 to 12 months, we're going to have this 15-minute sharing session. So, for those Connecticut nursing homes that have signed an Interact participation agreement with your community, and you know who you are because you signed the participation agreement, please stay on this line. You're going to be staying on mute until we open it up, but please stay on this line and do not hang up, because we're going to be just talking about the homework that we have for you for the next month. For those in Connecticut nursing homes that have not signed an Interact participation agreement with your community, you can go ahead and hang up. And you'll be getting an email from us, again, for the evaluation and then for the instructions on how to get the information for the webinar, as well, the recording, as well as for the presentation. For those nursing homes from Rhode Island, you'll see on this slide there is a phone number you're going to hang up, and you're going to call back into this phone number that's on the slide for Rhode Island, and you will be talking with the New England QIN-QIO Rhode Island State Care Transition Lead, who is Kathleen Calandra. She's lovely. You're going to love her. And for those nursing homes from the New Hampshire state, you will hang up and then call back using the number along with the passcode that is on the slide for New Hampshire, and you're going to talk with your New England QIN-QIO New Hampshire State Care Transition Lead, who's also lovely, Joyce Johnson. And so for all of the other nursing homes that you're saying, well, you know, I found this information on the QualityNet website and I'm just calling in, I wanted to see what it was about. Again, this is the time for you to hang up, because right now this is going to be state-specific sharing session for Connecticut, Rhode Island, and New Hampshire. So for all of you who are hanging up, thank you so much for joining us, and see you next month on March 25th at 1 o'clock, and we'll be talking about the Interact Readmission Tracking Tool. I'm going to leave this slide up for another minute, and then I'm going to go right into the Connecticut nursing homes who have signed on with a participation agreement. So thank you so much, and I'm just going to put you on mute for just a minute.
Leaving.
Okay, all right, we're going to go on. I hope we have said goodbye to our Rhode Island friends, our New Hampshire friends, Vermont, Maine. Also, they have not started a state initiative yet, and that's why they have not formed a community to work on this yet. And all those Connecticut homes that have a signed participation agreement, let's talk about your homework. Okay. Everybody ready? You got your pens ready? All right, so these are for the nursing homes in Connecticut that have signed the participation agreements with your communities. As we mentioned at our last webinar, which was on February 4th, we did a Interact orientation webinar. The three of us, it was myself, Sheila, and Florence, and we talked about the commitment of Qualityne to the Connecticut nursing homes that signed the agreement. We talked about the commitment of your community leaders, and also the commitment of the nursing homes that have signed the participation agreement. The three communities that we are working with in Connecticut are the New Haven community, the Middletown community, and the Hartford community, which includes Greater Hartford community, which is the Hartford Hospital, and also we have the St. Francis community, that's St. Francis Hospital, the Farmington community, which is the Yukon Health Center, the Central Region community, which includes the Hospital for Central Connecticut and Mid-State, the Bristol community, which is Bristol Hospital, the Eastern Connecticut Health Network community, ECHN, which includes the Manchester Hospital and Rockville Hospital, and finally the Eastern Region community that includes Bacchus and Wyndham Hospitals. So those are those communities that have agreed to work with the New England QIN-QIO, which in Connecticut is Qualityne, to then implement the Interact program. So this is the start of it, and this is the start of the accountability of each of the participants. So what we are asking the nursing homes to do for this month that have signed the participation agreements are 5 different things. First, we're going to give you some homework. And during the month, Florence, myself, and Sheila will be calling nursing homes randomly to find out how you're doing, what are your barriers that you've encountered, or what are your lessons learned that you've learned, or what is the shining star that you have started working with in the Interact program. So then we can share all of the lessons learned on these sharing calls. So please, if you see that Qualityne is calling, please please answer the phone. That's one of the barriers that we have hit in the past, and we're saying up front, all this information will be passed on to your community lead about were they able to connect with us or not. Next, part of the homework is you're going to be implementing a tool. And then, again, with this implementation, we want to know how's it going. Also, we are expecting you to stay on the sharing portion of the call to discuss all the lessons learned and barriers that you've encountered. Also, during your community meeting, now each community has, some are monthly, some communities meet quarterly, but whenever you meet as a community, the community leader has agreed to put this on the agenda, to put this initiative on the agenda. So you need to come prepared to talk about the work that you're doing and all lessons learned and barriers that you've encountered, along with your readmission data once we have talked about the readmission tracking tool. So you can't, but what we're asking you, the community meetings are only so long. So you need to be prepared to speak succinctly and within a time limit, so you'll let other nursing homes talk. So that's the accountability piece of what we're asking each nursing home to be prepared to discuss on a monthly basis. So here's your homework. And I don't like the word homework because I was in school for so many years, but this is all good stuff. This is going to help you really get the Interact program implemented in your facility. So we're the push to get this going. So the first thing we're asking you to do within the next month, from today, February 25th to March 25th, you're going to develop an Interact team. Now, as Sheila has talked about in her presentation, you already may have a quality improvement team structure in place. That could be your shell of the team, but now you need to bring leadership in. You also need to bring the frontline people in. You want to grow your team as you're growing the program, so more and more people are going to become champions, and as Sheila says, they will be your disciples about the Interact program. So that's the first thing you need to do if you don't have a team in place, is to develop a team. Your second is to have a team meeting. So within the next month, the next 30 days, you're going to have a team meeting. Now, am I saying that every team member has to be identified and start with the team the very first day? No. Your first team meeting may be 3 people, but you're going to talk about who else should be on the team and when should you have your meeting, because you want to make sure all 3 shifts are going to get the information and could possibly have participate on your team. So that's the second thing, have a team meeting. Your third homework assignment is, during this first team meeting, you are then going to go onto the website, the Interact website, and look at the different tools and the different areas that Florence talked about today. Our goal within the next few months is to have you become an expert on the Interact website. So when Florence says to you, okay, let's go to the communication area and let's pull up that stop and watch, you're not going to have to wait for her to go click, 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 click. You're going to be clicking right there as she's talking, because you're going to become so familiar with the site and what's on the site. So that's your third homework assignment. So first, create a team. Second, have a team meeting. Third, during that team meeting, you're going to go on to the Interact website and start become familiar with the site itself and what is available on the site. Fourth, you are going to meet with your leadership to talk about the Interact program. You need to talk about exactly what Florence talked about today, about why it's so important. You bring the slides, a copy of the slides, especially those 4 slides that really talk about the Interact program and what it does for your facility, what it does for your residents. It's all about patient care. That's why any one of us in the room right now, we're here working at Quality, and we're here working with the New England QIN-QIO, because we care about the patient and the resident and their families. So that's what the number one goal is to provide better care within your facility. But you also need to talk to leadership about the time commitment. We're not trying to add work, but we're trying to better the work that you provide. So there's going to be some upfront work about the team development and getting this program up and running. So leadership needs to know the work that you're doing. You also need to, as Sheila mentioned, include your medical director. That he or she is key to the work that you're doing, and because he or she is going to be part of some of the tools that you're going to be using, with the expectation, especially like the SBAR, and how people communicate to each other. So it's very important that you talk to leadership and your medical director. So that's your fourth homework assignment. And finally, number 5, your next staff meeting, you're going to talk about the Interact program. As Sheila says, everyone in your building needs to know that this is going to be a new change, and it's not going to be the flavor of the month. This is how it's going to be forever. Because this Interact program, once you realize what it's the value it's bringing to your facility and to the people you work with and the people you work for, meaning the residents, it's all about bettering the whole work environment and bettering it for the resident. So those are the 5 homework assignments that we are asking each of the nursing homes that have signed the participation agreement to fulfill within the next month. Now, when we call you, and again, we're randomly going to call, we have 62 nursing homes. So there's 3 of us, 62 of you. So we're going to be randomly calling. We're not going. Well, maybe this month we might call all 62. We might, just to see how you're doing and just to touch base. Now, again, we just want to hear how you're doing, the plan in place, on how you're getting your team together, when you're going to meet, and then we're at your next community meeting. Also, be prepared to talk about these issues. Now, I know tomorrow the Middlesex community is having a community meeting. I don't think Terry Savino is going to expect the Middletown community nursing homes to have a meeting between now and then. She's tough, but she's not that tough. So, again, you are going to want to have your meeting between now and next month, which is March 25th. And then you'll talk about your team meeting at your facility at your next Middlesex community meeting for next month. So, we have exactly 2 minutes left. I'm going to open up the phone lines. Again, this is our contact information for the Qualidine Regional Team for the Interact program. If you would like to ask a question, you can either ask on the chat line or hit *6 to unmute your line if you have any questions for either myself, Sheila, or for Florence. We'd love to hear from you. Boy, you're very quiet. Hopefully next month we're going to be calling on nursing homes to talk about their team meeting, what they talked about, what you talked about, who did you have at the table, who else do you think you would like at the table. So again, this month is a very important month to really get this program up and running. It's a lot of planning, a lot of future thinking, but I would recommend to do exactly what Sheila recommended during her presentation. Look at the big picture. Look at where you want to go. What is your facility going to look like when you have the Interact program initiated, and then start processing it down to say, okay, how are we going to get there? And that's our job here at Qualidine. We're going to help you, but you also have to make sure you have that vision of what you want it to look like.
Hi, Carol.
Hi.
Hey, this is Grace Jang from Young Haven Hospital. How are you?
Hi. Good. How are you, Dr. Jang?
Terrific. Really appreciate you doing this. I learned a lot as well. And I just wanted to put it out there for our Yale New Haven Hospital Collaborative. It's March 11th. Wednesday, March 11th from 11 to 12 p.m. And really do look forward to the skilled nursing facilities to be able to share their experience of how the team meetings are going and just what your plans are for the Interact.
Excellent. Dr. James, you have about 38 nursing homes, so you're going to have to randomly select some nursing homes to talk.
I can either randomly select or, those who have really some good experiences want to share best practice.
Excellent. Perfect. Thank you so much for being on the line and letting the nursing homes from the New Haven area know when their next community meeting is. Excellent. Thank you. Anyone else have a question or a comment? Well, thank you all so much. It was a pleasure being with you today for the last hour. And again, our contact information is right up there on the screen, so please don't hesitate to call any one of us. We'd be happy to help you out, and good luck. And we'll see you next month. Thank you so much. Take care.